To locate the point, the bladder 14, this one is 1.5 June lateral to the posterior midline on the level of the lower border of the spinous process of the fourth thoracic vertebra, that is the T4. So as illustrated, we check the picture. First, we need to locate the spinous process of C7. From there, count down for spinous process to the lower border of the spinous process of T4. Measure 1.5 June lateral to locate bladder 14 on the highest point of the paraspinal musculature. Or with the patient seated and their arms hanging down, the spinous process of T3 is generally on the level of the medial end of the scapular spine. The next spinous process in an inferior direction belongs to the T4. Locate bladder 14, 1.5 June lateral to the midline. Located on the same level are a point of extra point EXB2, which is 0.5 June lateral to the midline, and bladder 43, 3 June lateral to the midline. For needling, we use 0.5 to 1 June obliquely towards the spine or transversely subcutaneously. We need to have a caution. Be cautious for the pneumothorax. For actions and indications, bladder 14 regulates and tonifies the heart, unbinds the chest, regulates the chi, calms the shen. For special features, bladder 14 is the Back-Shu point of the pericardium. Bladder 14 is frequently used in the heart conditions such as arrhythmia, tachycardia, angina pectoris, and coronary heart disease. In particular, it has a pronounced effect on the chest and in relieving pain. The explanation of the acupuncture point says, when the heart is not settled, the pericardium channel is affected and there is chest pain. Bladder 14 should be reduced. The chest is the residence of the heart, lungs, and pericardium. This point is also strongly moves chi and invigorates blood. The same text says when there is accumulation of chi, when there's accumulation, and it stagnates, causing stasis of blood. The pericardium controls blood, and draining this point will eliminate the stagnation and the mental restlessness. Bladder 14 is an exemption among the Back-Shu points in that all the others are named after the respective Zang-Fu. Sang or Fu. The fact that bladder 14 is named after the Jueyin, the pericardium and liver channel, emphasizes its ability to unbind the chest by invigorating the circulation of chi. When liver chi stagnates, usually as a result of emotional factors, it frequently binds the chi of the upper jaw, giving rise to symptoms such as pain and oppression of the heart, chest, and diaphragm, restlessness, agitation, and oppression. As the Back-Shu point of the pericardium, bladder 14 is not exclusively reserved for chest and heart disorders due to chi stagnation, but in combination with bladder 15 is widely used to regulate the heart in many kinds of dysfunction. The descending function of both the stomach and lung is assisted by the stomach and obstructed movement of liver chi. Smooth. When liver chi stagnates and impairs their descent, there may be cough and vomiting respectively. Heart pain, bladder 14, heart 7, and GB 41. Thank you for your attention.